Time to bring in a Wednesday morning our good friend Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, and always great insight into the world of sports medicine. And, of course, you just heard the promo. We've been talking about it throughout the week. It is Ohio State-Michigan week. It's always big. Maybe even this year a little bit bigger if that's even possible. But there's also a situation when we talk about sports medicine with Michigan, and everyone wants to know the status of the Michigan quarterback and the injury, and if he's going to play, how effective he will be. And at that point, Mr. Congeni, come on in here, Dr. Joe. What do you got?
Yeah, well, I'm not going to say too much because Wilton Speight came in my office yesterday. No, I was telling you, Ray, that people are expecting, like I examined the guy, could a guy with a broken collarbone, it was reported that he had a fractured clavicle. People know that's a broken collarbone. Could he really possibly play in Saturday's big game, the game? And I appreciate all the great interviews you've done leading up to the game. So this is really the big question related to the game. And the Michigan head coach, Jim Harbaugh, loves a little bit of drama. He loves the element of surprise. And so we really don't know what they're up to. I know that he warmed up and dressed for last week's game. I know that originally on November 13th and 14th, they talked about a clavicle fracture. And then Harbaugh really came back with a couple of interviews where he said he's not out for the year, it's not a definitive clavicle fracture and things like that. So what's most likely in seeing the injury, the fact that it's his left arm, the fact that he actually had the injury and then continued to play in that Iowa game and finished out the Iowa game, is that it's not a mid-substance clavicle fracture in the middle of the clavicle where kids break it. It's a very common fracture, as you know. We have lots of those down at Sports Medicine at Children's. And in athletes of that magnitude, we often will actually put a plate in there and fix them surgically. And they're definitely out, he'd be out for the year. So more likely, Ray, what we're dealing with here, by the nature of how the injury occurred, is probably a separated shoulder, which is a torn ligament, partially torn ligament in the non-throwing shoulder. And when the ligament tore, it probably pulled off a small piece of the clavicle or the collarbone, and the fracture probably is at the end of the bone. And depending on if the ligament is healing, there may be the possibility we may see Wilton Speight in Saturday's game.
Joe, okay, even if he plays with that type of injury, a lot of times we compensate our body with an injury like that. How effective can you be, and how bothersome would an injury be like that, even if it is on his non-throwing shoulder?
Ray, it really is very much related to the injury to the ligament more than the bony fracture in these situations. So if he had a more significant ligament tear, we grade them 1 through 3. If he had a bad grade 2, mostly torn, a week and a half probably wouldn't be enough for a lot of healing. If it was a more kind of less significant grade 2 partial tear with a small fracture with it, he may be able to function. But there is a downside for Jim Harbaugh and the coaching staff, is if they are considering him playing, the medical staff and the coaching staff really don't know till you take a hit. This is an injury that until you land on that shoulder again, you really don't know what you have, and you could very easily, with the first hit you take where you fall on that shoulder, undo some of the ligamentous healing that you've had. And so this leads to a lot of anxiety for medical teams, and so people like us sometimes, because you really can't tell. He can go out and throw, he can run plays, but until he gets hit, exactly as you said, you don't know how that torn ligament in the shoulder, i.e. the separated shoulder, how it's going to hold up in a big game.
Dr. Joe Congeni with us, Sports Medicine Center at Akron Children's Hospital. Joe, back to last week's Steelers-Cleveland Browns football game. We had Cody Kessler get another concussion. That's 2 concussions in 29 days. And we were just speculating that may be it for him for the season. But how, and you have spent a lot of time, research, and done a great job of educating all of us on concussion. In that world of concussions, two concussions in 29 days, what does that mean now? And also going forward in the young man's career?
Yeah, I was unhappy with a few plays in that game. Is that they're really talking about how they have to reduce hits. And again, I know we've beat the drum on this a lot, and people know it's not just when you hit somebody helmet to helmet, but when you're launching yourself and using the helmet as a weapon. And at least 3 times in the last quarter of that game, I saw defenders launch themselves at offensive players and use the helmet as a battering ram, as a weapon to hit athletes, and whether they get hit helmet to helmet or not when the head snaps back. So in that play, Lawrence Timmons throughout the week has said in the paper through several interviews, I didn't even really hit him much and everything. He totally launched himself from about 3 yards away, and there's no doubt that Kessler's head snapped back. And if they're going to get serious about that, those are the kinds of plays. They happen a lot in football. Football fans hate flags, but if we don't start calling that play and people continue to use the head as a weapon, the helmet as a weapon by launching themselves, we're going to have a big problem. So yes, I think it was a significant injury for Kessler. Yes, he's had a few this year, and I'd be very concerned about him coming back. And yes, there were some things that I thought crossed the line, and the NFL has to take a bigger stand. I think people, a penalty alone, some weren't even penalized. I think people need to be ejected.
When you look at Cody Kessler, 2 concussions, rookie year, and let's say even if he does go out the rest of the year, what does that do to his career possibly going forward? I've always heard you get that 3rd concussion, you really have to start thinking about a career. Is that true or not, Joe?
No, it's really so much more individualized into how long the recovery time is, how significant the symptoms are up front, which of course we don't know in this case with Cody Kessler. So it's very individualized. So the old days of we used to hang our hat totally on 1st concussion out a week, 2nd concussion out a month, 3rd concussion done with the year. But there's so much difference and variability. That has really gone by the wayside, maybe even as long as 10 years ago. So we don't know how significant his concussions are. While we're talking those in the in the NFL, professional football, one that I am concerned about too, and by the position he plays, is a great middle linebacker like Luke Kuechly, an inside linebacker like him. His did not look good on the field. And really, to be honest, Kessler took a long time getting to his wits on the field. We don't know at all in either of those two what happened then in the training room evaluation, but it's very individualized now, so we don't know. And if he was out for a full year next year, we think that the brain does a lot of healing over that period of time. But and that's why you asked the question, there is some point where we get to that cumulative effect where even a lesser blow will cause a kid to have a concussion. And it's at that stage, if we can tell that stage, that we tell kids they really should stay away from contact and collision sports.
Good stuff, Joe. Thank you very much for the insight, the visit. Have a good Thanksgiving, and we'll catch up with you next week.
Thanks, Ray. Have a great Thanksgiving with your family.
All right. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, talking to us about the Michigan QB and, of course, Browns quarterback Cody Kessler.